Hi everybody, it's Dr. Kendall Peters from the Center for Plastic and Reconstructive Surgery. Today we're going to have a little educational on breast augmentation and some of the salient points that come up frequently when we're talking about breast augmentation with a new patient. Um, uh, Breast augmentation is typically done with breast implants. Implants can be saline or they can be silicone. They're advantages and disadvantages of both. Certainly the most common implant used today is a silicone implant. Ultimately, the choice comes down to what's best for each individual patient. Those kinds of determinations are made when you come in for your consultation. Most people would say that silicone feels more natural, it's more consistent with what breast tissue feels like. Saline implants can feel a little less natural, maybe a little bit more like a water balloon, but they do the job as well. Generally, rippling is when the shell of the implant can be seen through the breast tissue, causing some rippling of the tissues. That tends to happen a little bit more with saline implants than with silicone. Those are the main differences, but most people tend to choose silicone because of the feel and the look. Another important distinguishing part of breast augmentation is whether you go above or below the muscle. And some people call this a subglandular augmentation when it's below the gland or above the muscle, and it's a submuscular augmentation when it's below the muscle. The muscle has been shown to have some protective benefit on capsule formation. Capsules are a scar response that can occur in everyone's body in response to seeing a foreign body in there or seeing the breast implant. So, and in some people, capsules can be quite aggressive, and it can contract and cause the implant and the breast to become hard. So we know that in the most recent data that implants that are placed below the muscle tend to have a little less risk of encapsulation or capsular contracture. Other things that can occur with implants when they're below the muscle, some would say that the implant can be held a little higher in the breast, the muscle sort of holding that up and supporting the implant. If someone has some early ptosis or sagging of the breasts and they're resistant to the ideas of doing a breast lift, then an implant placed in the subglandular position or above the muscle can oftentimes sit in a little bit more of a natural place and sit a little bit better with the breast tissue. Another topic that we discuss with breast augmentation is size, and I will say that the majority of complications that occur with breast augmentation are related to people going too large with their breast implants. So we need to be very thoughtful about what size we pick and how we go about sizing that implant for the patient. We use a combination of things. One is tissue-based planning. So when you come in for your consultation, we'll take some measurements. We will determine the width of the breast. We'll determine the position of the breast on your chest wall, the distance from the nipple to the fold of the breast. All of these things contribute to our tissue-based planning and picking a suitable implant that will fit exactly to your breast size. Obviously, we also look at what a patient's expectations are for what they're hoping to obtain with this, and sometimes some pictures can be helpful, and we will get an idea of what we're trying to achieve. Those are the main talking points for breast augmentation. The final issue with size is trying on some implant sizers, and we have some clothing sizers that give you an idea or a visual about what your breast might look like in your clothes after having had a breast augmentation. So hopefully this provides some insight on breast augmentation. We've talked about silicone versus saline implants. We've talked about positioning of the implant above or below the muscle, and we've talked about size. So come see us at CPRS. We'd love to help you with this exciting surgery.